The fear of getting COVID-19 has many cancer patients frustrated.
CBS 4's Tylisa Hampton shows us how a doctor is urging cancer patients to continue treatments.
Although there are options for cancer patients to get consultations during the pandemic, Dr. Carlos Garcia Cantu says one is better than the rest.
The best one is actually to see the patient face to face. That is the best consultation that you can get. However, there are some alternative methods, Zoom, for example, or telehealth.
But because COVID-19 is far from gone, some cancer patients are afraid.
The COVID patient will attack every single system, and that will be devastating for a patient who is immunocompromised because of the fact that they are receiving cancer treatment.
Anxious to visit a doctor's office or go to the hospital.
We do see a lot of frustration with our patients. They cannot leave their homes. It is very difficult for them, and sometimes there is a little bit of a lack of information on what they can do. That's why it's very important to know that if you come to receive your chemotherapy treatment, it's going to be safe.
He says the worst thing a patient can do is delay treatment.
It's extremely important that no cancer treatment is delayed.
After battling cancer for 2 years, Dolores Rodriguez took a break from chemo. That's when she said things took a turn for the worst.
They found out that I have the tumor in the lung that was the size of a quarter grew to the size of 3 golf balls. So it's basically blocking my airway in my left lung. And I'm basically using only one lung to breathe.
Now Rodriguez says she hopes no one delays chemo because of her own experience.
It's very necessary for them to continue doing chemo because look at me. I stopped doing chemo, my decision. And from July till we're in October, my tumors grew.
Happy to be back on chemo.
I am going to continue chemo. I have an appointment next week. Hopefully we can talk about radiation to, maybe shrink the tumor a little bit so I can have relief and breathe.
Dr. Garcia Cantu says cancer patients need to continue their treatment, preferably in hospitals, and not delay them, and for people to seek medical attention if needed. Working for you in Edinburgh, I'm Tylisa Hampton.